In contrast, this study, and most of you will be familiar with this, it's to do with the socket shield technique. And as a proof of principle, this study demonstrates what happens when you take a tooth out, but you leave in a portion of the root which remains connected to the facial bone. Once again, it's in a dog model, but instead of the maxilla, the model utilizes the mandibular premolars, which have been hemisected and decoronated, and the distal root was divided, leaving a portion of the facial root face in situ connected by the periodontal ligament to the facial bone. And then they placed an implant immediately lingual to the retained root fragment, and then did histology. Now, of course, this is a mandibular case, but I've flipped the image around so it looks more like a maxillary case just for comparison purposes. And you can see on the left histological image retention of that facial root fragment, which is demonstrated as the capital letter D with the red arrow. And on the right-hand side, a closer image showing that after a healing period of some weeks, there is absolutely no evidence of resorption of that facial bone, which you can see remaining close proximity to the root fragment that remains in situ, and of course the implant further to the right-hand side. So there's absence of osteoclastic activity and complete preservation of the facial bone.